This year marks the 50th year. Hi, I'm Dr. Tom Bender. Developing this new website has been both exciting and a challenge. As I look toward working on this in my retirement, I've become a bit philosophical about how my career in medicine has evolved. It's been fun to look at how my experiences have led me to this point of providing preventive medicine services online to individuals in their homes, one person at a time. It was 50 years ago that I excitedly entered the field of medicine. When I entered medical school 50 years ago, I was very interested in prevention. I just thought it made sense. However, that emphasis was soon reduced from high priority to low priority, and prevention was viewed by all of us new medical students as a lot less important in relation to the demanding and exciting aspects of clinical medicine. All our interests were directed at learning how to diagnose illness and treat or even operate on those who were sick. While there actually was a course on preventive medicine at our medical school, it was held on Saturday morning at 8 o'clock in the first year and was taught by retired county health officers. At the time, if you could even get up after studying all night and actually attend, the lectures seemed pale next to the excitement of surgery and clinical medicine. Between my freshman and sophomore years, I spent the summer in the Yukon Territory of Western Canada and traveled further north and west to Alaska. I loved it, and I was anxious to get back to the north and to gain more clinical experience. So in my senior year of medical school, I spent 6 weeks in a clinical clerkship on the Quebec-Labrador coast at a small one-doctor hospital developed and managed at that time by the International Grenfell Association. Again, I loved it. During my first year in residency, my internship year, I had an opportunity to take a brief elective in preventive medicine. This rekindled my early interest in helping others take steps to prevent disease, and especially serious sequelae. So when I had an opportunity to return to Alaska as a medical epidemiologist with the National Communicable Disease Center, now the Centers for Disease Control and Prevention, or CDC, and at the same time meet my military obligation, I jumped at the opportunity. My 25 years with CDC led me into numerous really exceptional assignments, and while there I certainly saw the real value of the strategy of epidemiology, the basic science of public health. All of these experiences helped develop my long-term strategic approach to preventive medicine. During this part of my career, our first step was usually to identify the leading causes of morbidity and mortality in the populations we served. Next, we had to focus on identifying overall risk factors, and then, considering the state-of-the-art in prevention sciences, we had to figure out ways to apply appropriate prevention tools within the population in a cost-effective manner. Furthermore, we had to prove that what we were doing was feasible and it actually had a cost-effective, beneficial effect. When I retired from CDC and entered the private practice of clinical preventive medicine, I remained convinced that the same strategy would be useful for individual patients. At about that time, a broad wellness movement was developing in the U.S., and some people gradually seemed to become more interested in actual involvement in their own care and in living a healthy lifestyle, if they just knew their choices. So from the beginning of this phase of my career, I helped patients use tools to identify their most important risk factors, and then, considering the currently available personalized prevention approaches, I help them set goals and take the steps needed to reduce their risks. Thus the strategy continues, even in the development and implementation of this website. As a public health professional, I dealt with the health of populations within communities, remote villages, and islands. As a clinician, I dealt with the health of individual patients. Which is more effective? They both are very helpful, and the benefits are evident when you view it from either level. If you're interested in more philosophy regarding the value of working with individuals, you may listen to a set of remarks that I made way back on July the 20th, 1993. These snippets are from a presentation I made in Morgantown at a retirement reception held for Dr. J. Donald Millar, my last supervisor while I was at CDC. And these concepts are still relevant today.